My name is Jamie Peters. I'm a registered nurse and certified respiratory educator at Lung Saskatchewan. Lung Saskatchewan is Saskatchewan's oldest charity, and we've been around for over 110 years. So we've been at the forefront of improving lung health in Saskatchewan. Through these years, our commitment to continuous improvement has fueled our passion to advance our work in order to serve you better and to meet our mission of improving lung health one breath at a time. We've been running these support group meetings for sleep apnea for close to 2 decades. Before we present today, I want to acknowledge that the land that we're on, we're hosting this webinar today on Treaty 6 territory, the ancestral and traditional territory of the Cree, Dene, Blackfoot, Saulteaux, Nakota Sioux, and the homeland of the Métis. We acknowledge the many First Nations, Métis, and Inuit whose footsteps have marked these lands for generations and reaffirm our relationship with one another. Some of you may be on land other than Treaty 6, so we encourage you to find out a little bit more about the land you work, live, and play on and acknowledge it as well. It's also Pride Month, and Lung Sask really supports anyone with lungs, okay? I'm going to introduce Megan now, and some of you may have met Megan at one of our past sessions. Megan Pegg is a registered nurse who has a Bachelor of Science in Nursing and a Master of Nursing from the University of Saskatchewan. Her background was in pediatrics and neonatal intensive care nursing, and she has also taught for the U of S College of Nursing. In October 2023, she joined the staff at the Sleep Disorder Center, and we're so happy to have her, and she's getting her feet wet, helping out with these sleep meetings, the last couple meetings we've had. So thanks, Megan. I'm going to pass it over to you, and we'll get your presentation up and running.
Thanks, Jamie. I'll just share my screen. Okay, I just want to introduce myself. My name is Megan. I'm a registered nurse. I work here at the Sleep Disorder Center at Saskatoon City Hospital. I started here in October. I like to say first and foremost, I'm no expert, but putting together these presentations has really helped me learn a little bit more, especially answering the questions at the end. After the presentation that we did last year, there was a lot of questions about follow-up. So we decided that that is what we would make our topic for this next presentation. So today I am going to be talking about taking action for follow-up sleep apnea care. And I have with me Tamara Brizette from SAIL, so she'll be here to help answer questions at the end as well. So I'm just going to talk a little bit about the vision, mission, values, and philosophy of care at the Saskatchewan Health Authority. Our vision is healthy people, healthy Saskatchewan, and we work together to improve health and well-being every day for everybody. We value safety, accountability, respect, collaboration, and compassion. As Jamie mentioned, the SHA Treaty Land Acknowledgement is about honoring relationships with Indigenous people. We recognize this history is important to our future and our efforts to close the gap in health outcomes between Indigenous and non-Indigenous people by knowing what the land and traditional people of the land offer us. So today I'm going to be talking about sleep apnea, some common symptoms, what happens when without treatment, so not using your CPAP machine, troubleshooting common problems, and then who to contact about those problems, when follow-up care is recommended, and how do you even know you need follow-up care? That's kind of a big question for us. Who do you follow up with? When should you talk with your private vendor? When should you talk with myself or Susan, the sleep nurse educators? When should you talk with your physician? And then when should you contact the SAIL department? So some common symptoms and what happens without treatment. So apnea is an absence of breathing. So sleep apnea is pauses or absence in breathing while you are asleep. Sleep apnea is a serious condition, and in some cases, it can even be life-threatening. Sleep apnea is easily identified by a sleep specialist and can be effectively treated. Some common symptoms of sleep apnea that you might have seen in yourself or someone that you know is excessive daytime sleepiness, snoring that can also come with pauses in breathing, high blood pressure, gasping or choking at night, lack of concentration and or memory problems, irritability, depression, waking up with a headache, waking up multiple times at night, often to pee, or sexual impotence. If left untreated, the consequences of sleep apnea can be very serious. So that might be high blood pressure that's hard to control even on medication, an irregular heartbeat, having a heart attack or a stroke, wheel accidents that are caused due to sleepiness, falling asleep at the wheel, work-related injury or injuries from operating heavy equipment while sleepy, and then a decreased quality of life. So some common problems and who to contact. You may experience a dry nose, a stuffed up nose, so nasal congestion, sore or red areas around your nose, mouth, or from your headgear, skin irritation, mask leaks, mouth leaks, removing your mask at night without knowing that you're doing it or remembering that you're doing it, and water in your tubing. One of our major concerns, we get a lot of calls here in the sleep lab about this. This can be very tricky and it's hard to use CPAP successfully when you're having problems with the fit of your mask. So first of all, is your mask leaking? You can adjust it as needed for changes in sleeping position. Sometimes when you move around in bed, you do break the seal. You want to adjust your headgear. It should be just tight enough to make a seal without leaks or pain. You will know that it is too tight if it is causing you discomfort. You want it to be tight enough that you have that seal, but not so tight that it's uncomfortable. If your headgear is uncomfortable or your mask is uncomfortable and is causing you pain, please talk to your private vendor. We'll talk about this after. Please talk to us. It means that your mask is not fitting properly. You may have to consider trimming or shaving facial hair for a better seal. It can be hard to get a good seal on a mask when you have facial hair. There are certain masks that do work better for this. You want to avoid using oily creams on your face, especially at night. This is important. A small air leak is okay. It can be uncomfortable though if air is blowing into your eyes, and this is something that you'd want to discuss. It is recommended to replace your mask every year, at least every year. Some people have to replace their mask sooner. Some people are able to continue using their mask a little bit longer. If you clean your mask daily, so you want to clean it with a warm, wet cloth, wipe off those face oils that naturally build up on your mask over the night, and then do a deep clean every week. So you're going to want to soak your mask in warm soapy water. You might need to use a cloth to clean it. Give it a good rinse off all that soap, and then let it air dry. It's most helpful to do this in the morning so that it has an opportunity to dry during the day and is ready for you by the evening. So who to contact? When troubleshooting common problems, there's a few options for people you can talk to. So you can call your private vendor. If you get masks from them and you're having an issue with your mask, please call them first. See if they can help you through it. Is your mask old and needing to be replaced? Is it not fitting properly? Is it causing you pain or discomfort? If you've tried that and it's not working, you're still having some struggles, please call myself and Susan at the Sleep Disorder Center. We're here at City Hospital. That's our number, 306-655-0809. It is helpful for us if you have talked with a vendor that provides your mask first, especially if you've just gotten it. Many places you are able to exchange your mask in the first 30 days after you purchase it. You are not able to return it, but you are able to exchange it. So if you're having issues with how your mask fits and you've noticed it right off the go, and you've tried tightening it, repositioning it, you've talked with them, please don't feel like you need to suffer through. Talk with them about doing an exchange. When is follow-up care recommended? This is a big question that we get. So short-term follow-up is used to check. We use it here to check. Private vendors use it to check that you guys are using therapy. It's helping as it's supposed to. Sleep apnea is being treated. This includes a data of yours, a download of your sleep data. We want to make sure that sleep apnea is being treated, your mask is fitting properly, the leaks are being controlled, and that you're able to use it for the majority of the night comfortably. Long-term follow-up is recommended to check that CPAP therapy is still helping with your symptoms. Again, this will include a download of your sleep data. We want to make sure that it's being treated properly. Again, your leak is being managed. Have you been able to use the equipment nightly and things like that? Sometimes things can change over time. And so we want to help patients work through whatever is going on with them. There are no official guidelines on exactly how often follow-up care should be done. Often this is patient specific. You'll find that we find that with patients that come into the lab, that it's not consistent. It may be helpful to get a download yearly when you're getting a new mask. That can be a good reminder. You're in with your vendor. You're getting fitted for a new mask. Hey, can you please do a download of my information? I'm on AirView. You can bring in your little SD card out of your machine. If you're not sure how your SD card works, you can always bring in your actual machine, and then they are able to help you with that. So how do you know when you need follow-up care? You may need follow-up care if you're having difficulty tolerating the air pressure that's blowing from your machine. So this may be from a recent prescription. You may just have had your sleep test. You may, here in the hospital, you may have just finished an auto trial. You may just have recently seen your doctor and your prescription was changed, and then you go home and you try it and you realize you're having trouble tolerating it. This may be, you might have be on a pressure for years, and all of a sudden you're finding it difficult to tolerate. If you have previously worked with a private vendor or myself or Susan to manage a mask fit or a leak if present, sometimes the air pressure changes or is difficult to tolerate because your mask is not fitting properly. Sometimes if we've done everything with the mask and you're still having difficulty tolerating the air pressure, then you're going to want to get some follow-up. And if you've had weight loss, if there is a weight loss greater than 10%, that's just a rough number. Some people need to lose a little bit more weight before they feel difficulty tolerating the air pressure, and some people less. So that's just a guideline. If you start finding it difficult to tolerate the air pressure, you're going to need follow-up care. If you feel like you are not getting enough air, we call this air hunger. This can happen if you experience weight gain. There may also be the return of your sleep apnea symptoms. Or not getting enough air is just something you can experience over the course of time. Again, this can be with a new or old prescription, but it is something that would require you to need follow-up care. If you have not noticed a change in your symptoms since using CPAP, so you get prescribed a CPAP machine and you find, I'm still very tired, I'm waking up multiple times through the night, my partner tells me I'm still snoring, you wake up choking or gasping, you're going to want to get some follow-up care. Your symptoms of sleep apnea have returned after having a good response when it started. So you started using CPAP therapy, your snoring stopped, you were waking up feeling refreshed, And then you start noticing that that's not the case anymore. You're feeling very tired when you wake up, or whatever your symptoms were have now returned. Repeat tests are not routinely done in patients who continue to have a good response to their CPAP therapy. It's generally just done if there's any concerns. So a return of some sleep apnea symptoms might include somebody seeing that when you're sleeping, you're taking those pauses in breathing or having those apneas. You're snoring again, you're having choking or gasping. You're very tired and you're not sure why. There's no other reason you can think of that can explain that. You're having less quality sleep. It's not as refreshing. You're sleeping more or less than normal. The total amount that you're sleeping has changed. You're waking up in the morning with a headache. You're not able to concentrate as well. You may have some memory loss, be irritable, have decreased libido, or be experiencing erectile dysfunction. So this is also important, and we get a lot of questions about this. Who exactly are you supposed to follow up with? When do you talk to your private vendor? When do you call the sleep disorder center? And when should you talk with your doctor? This can be your family doctor or your respirologist. So you'll want to talk with your private vendor about the common problems. So you're having mask leak, water in your tubing, things like that we talked about at the start. Replacing equipment as recommended. So if you're having equipment issues and it may be time to purchase new equipment, this, as I mentioned before, can also be a good time to get a yearly download just to see how things are going. Often patients don't realize that there could be a mask leak, that could be an issue. You're sleeping deeply, you don't realize, your bed partner might not realize there's an air leak either. You might have some changes that are causing you to, for your sleep apnea to return. So you're having more events at night. They're able to look at this just with the download. And if you're there anyway, making a purchase, the vendors are often happy to help you with that download. So for calling the sleep nurse educator, you've attempted to work with your private vendor, but you're still experiencing common problems with your equipment. You just can't get a mask fit or really any other issues. Susan and I are always happy to help. You're having difficulty tolerating the air pressure or any questions or concerns related to therapy. You're going to want to talk with your family doctor or your respirologist regarding scheduled appointments. You're going to want to, or sorry, and by that I mean how often, like when you see them, you can ask, when should I be seen again? How do you do this? How is follow-up care? How do you run follow-up care? Is it, if everything is going good, then no appointment, or should I see you in 6 months? How long are you going to be my doctor for? How long are you going to be following me for? Often a respirologist follows a patient for a period of time, and then if everything is good, then the responsibility of care goes back to the family doctor. So you want to have worked with your private vendor or the sleep nurse educator to correct any problems, but you're still experiencing difficulty tolerating the air pressure or experiencing air hunger. You have unmanaged symptoms or no change in your sleep apnea symptoms, or you've had a return of your sleep apnea symptoms. Sometimes it's just a matter of navigating. I feel like Susan and I do help a lot of patients. Sometimes it can be a little overwhelming navigating the system. So sometimes we just help people navigate who they should talk to or where they should go, and we're happy to answer questions about that as well. So when to contact SAIL. SAIL is the Saskatchewan Aids to Independent Living. They are programmed through the Ministry of Health that helps cover the cost of the CPAP machines that many of you guys have. So SAIL patients can contact SAIL when there is a malfunction with the device. Some examples of this would be when your machine is making noise, and that, please note, that is the machine that's making noise, not the mask or the tubing. the buttons are not working properly, or any type of motor fault or system error message. Now, this system error message will pop up on your screen when you go to turn on your machine, and it's trying to tell you that something is wrong. If you have questions or concerns about your machine, SAIL is available to help you and can troubleshoot repair issues. Sometimes they're able to help you over the phone. Sometimes you'll need to make an appointment to come drop off your machine, and then it will get looked at, and then you'll have an appointment time to come pick up your machine once it's been looked at. So I've included their phone number and their email. Please note that the SAIL depot does not assist with pressure adjustments. So anything to do with your air pressure, whether it's too much or too little, they are not able to help you with that, or therapy downloads as well. You're going to want to talk to your private vendor, myself or Susan, or your doctor if you have an appointment with them. Any cost incurred at a private company is the patient's responsibility. And that is basically it. SAIL is happy to answer any questions that have to do with the actual running of the machine. And they don't do anything with your treatment or the prescription of your air pressures. And then these are my references. And then now we can have a question period.
Thank you, Megan. Just before we go to the questions, I want to ask and clarify two things. If you have a non-SAIL CPAP machine, that should go to wherever you got the machine from for servicing. Is that correct?
That's right. Mm-hmm.
Okay. And if you are in Regina, I just want to say you'll always follow up with your vendor first, and then you can go to the Regina Sleep Disorder Center, who has some respiratory therapists who can help in your area, just as Susan and Megan would in Saskatoon area.